Aging and Awesome. You know, when it comes to transitioning back home from a hospital or even from a rehab center, if you or a loved one has ever actually had to do that, then you probably know it can be especially challenging if the right precautions and the services aren't in place for you. So here with us tonight is Travis Tumulty, who's going to explain the new Care Transitions program with Eden Health. Thank you so much for joining us tonight. So who is this for?
The service is for any patient who's discharging from one of our partnered Empress Healthcare facilities, like in this area, Mountain View, Gardnerville, and certainly Ormsby Rehab.
Okay.
It can also be in collaboration with one of the local hospitals. This service is provided regardless of whether or not they're going with Eden Home Health or Eden Home Hospice services. It's a free service outside their insurance to make sure they make a good transition home.
Yeah, and exactly what do you provide? What is it? What's involved?
The Care Transitions program provides an in-person care coordinator who functions in basically three capacities: as a healthcare navigator, as an advocate, and a care coordinator. And this service is provided regardless of whether or not they've already accepted home health, or maybe they didn't qualify, or have hospice services coming. The service also provides a custom telehealth setup for those patients who are discharging from one of those three Empress Healthcare facilities.
So where does it start? It starts while you're still in the hospital or the rehab center, right?
Absolutely. We meet with the patient, the Care Transitions team or myself, meet with the patient at that care facility and kind of establishes what their discharge plan and goals are. At that point, we also schedule a one-time follow-up visit that's usually to occur within about 3 days of the patient going home.
Okay, why do you think it's so important? I mean, does it make a difference?
Absolutely. Even as a patient myself, we usually go from a care facility setting where so many tasks are being done for us in order to help us heal and recover. And despite that care team being there, as we transition home, we oftentimes find ourselves alone or maybe with the care from others, but don't have the same medical support. So this service provides a very critical support structure at a very crucial time.
And the timing is pretty important.
Absolutely. The time that we provide this service is typically considered the riskiest period in a patient's recovery. That's most often when patients are likely to encounter difficulties managing their care and statistically the most likely to readmit to a hospital.
I know I heard you say this earlier, that it's free.
It is
How
free.
can it be free?
I understand. That's a huge reluctance in our world, but we really don't bill to any insurance. It's a totally voluntary program, and we do it because in 5 years of providing this service for free to our partners, we've demonstrated a number of key benefits to our participants. And some of those participants are they're significantly less likely to readmit to a hospital even 6 months after that one-time home visit and a follow-up call. There's two other great benefits that this service provides. One is they're more likely to obtain self-identified goals around their symptom management and their functional recovery. And the last is a huge one for me, is that patients who participate in this program, they report an improved quality of life in their recovery.
It really is for anybody of any age.
Absolutely. And I highly recommend if you have questions, comments, or information that you would like to please contact our Eden Health office.
Thank you very, very much. Travis Tumulty with Eden Health. Thank you.
Thank you for having me.